Are you struggling with heavy periods each month? If you are, this video is for you. I'm gonna go through 5 natural cures to heavy periods so that you can ditch the heavy bleeding, the big tampons and pads, and also feel like you can leave the house. If you have not hit the subscribe button yet, go ahead and hit the subscribe button and the bell to be notified anytime I post new content relating to women's health, hormones, and holistic health. You guys, I treat so many women with heavy periods. So many women come to me and they're like, I'm bleeding, even more often, like my cycles are 21 days or less sometimes. I'm bleeding all the time. They're super heavy. I feel like I can't leave the house. I'm soaking through bed sheets. I'm having to wear huge tampons or pads, and they're miserable. And so in this video, I'm gonna go through exactly some different diagnoses of what it could be and then what to do for it. Okay, so let's define what a heavy period is first so that we know what we're working with. So in a cycle, a woman should lose anywhere between 25 and 80 milliliters of blood per period. A lot of us don't measure our blood during our period, so that may not mean a lot to you, but I'm gonna describe what that looks like. So one regular tampon is going to hold 5 milliliters of blood. A super pad or tampon is going to hold 10 milliliters of blood. And remember, these are completely saturated. A lot of us may not get to that point, but remind yourself that 10 milliliters of a super tampon is going to be needed to be changed less than 8 times per period. So if you're changing a super tampon every hour or two for several days, you're probably medically defined as a heavy period. Heavy bleeding is also defined as, like I said, losing more than 80 milliliters of blood or also bleeding longer than 7 days per period. This is not medical advice for you guys, and I want to remind you first that the very first thing to do for heavy periods is to get a diagnosis. There's a reason that your body is eliminating so much blood during a period, and we got to figure out what is going on so that we can treat it appropriately. So different things can be things like coagulation disorders, so your blood not clotting as well and you're losing a lot of blood during that. You can have low iron or other mineral imbalances, low copper, low magnesium, those types of things. And remember, minerals all go together. So we don't just have usually low iron, we usually have low copper as associated with low iron or various other different things. And so sometimes doing a mineral hair test can be really, really helpful in looking to see intracellularly what's going on with your mineral status. Other conditions that can cause heavy periods are hypothyroidism. Hypothyroidism is a big one that can cause heavy periods, liver disease, pelvic inflammatory disease, polyps, fibroids, those types of things. And excess estrogen can also cause heavy periods and or combined with low progesterone. So remember, in each cycle hormonally, we're working with an estrogen progesterone balance, and we want those to be in a good ratio. So sometimes women have a lot of estrogen. Estrogen is the hormone that causes a lot of bleeding, but if you don't have enough progesterone, that also opposes estrogen and can cause that too. So moral of the story, guys, first, get a diagnosis, get some hormone testing, get an ultrasound, make sure there's not something growing in there like a fibroid, so that we know exactly what we're dealing with. Let's get some thyroid blood work done. Let's look at your iron levels. The kicker with iron also is low iron actually causes heavy periods, and heavy periods cause low iron. So we want to really diagnose and see, like, what is your ferritin level, what's your iron level, what's your hematocrit, your hemoglobin. All of those different markers on your complete blood count are very, very helpful in diagnosing that. But remember, low iron is usually not what's going on. Usually it's actually a copper deficiency due to our iron's recycling kind of center inside of our body. So this will be a whole other video for another day, but just remember that low iron may not actually just be low iron, it may have to do with copper as well. So if you've suffered from heavy periods through your entire life, your whole life of getting cycles, go to your doctor and have them check for von Willebrand disease, because that's a diagnosis that can cause heavy periods. It's a simple blood test. If you've never not had heavy periods, let's go get that diagnosis too and make sure that that is ruled out. or at least confirmed. If you have changed around heavy periods was normal and then it got heavier, whatever, let's look at some of these other diagnoses first. So back to what I said about hypothyroidism. A lot of people don't know this, and this is just a small caveat that I want to give you guys, because hypothyroidism can actually be a big reason for really heavy periods, and it can be undiagnosed for lots of women. Or maybe it is diagnosed, but we just don't know that that's the correlation to heavy periods. So when you have hypothyroidism, it deprives your ovarian follicles the thyroid hormone that it needs to produce progesterone. Progesterone, remember, counterbalances estrogen in your system and makes your periods a little bit lighter. It sheds that endometrial lining so that you don't have such heavy periods. If you don't have exposure to enough progesterone, your estrogen level is going to be higher, thus creating heavier periods. So if you have undiagnosed hypothyroidism, or even if it's diagnosed and it might be a little bit uncontrolled, a little bit high, in terms of your TSH, or low in terms of free T3, that could be a potential reason that you're having really heavy periods as well. So a lot of moms come to me and talk about their teenage daughters, and I can remember, you know, throughout the last several decades, my period's been different at different times of my life, but a lot of teenage girls have really heavy, crampy, horrible periods, and one of the reasons for them can be their endocrine system is still developing and getting used to the estrogen receptors. It's not quite sure what to do yet and how to do it, and so that immaturity can cause some of these bad symptoms that we see with our teenage daughters. And again, this can last about 1 to 2 years sometimes, but there are things to do for it. There are different herbal remedies to take for it. We can work on inflammation, we can work on stress, we can work on insulin. We can also give them acupuncture if they're up for it. Acupuncture is just wonderful for period problems in general, but especially for our teenage daughters, who we don't want to really start giving them a lot of different things yet, or maybe you want to avoid the birth control pill that your doctor has said, which I just did a video all about what the birth control pill is doing to our body, so go check that out if you're interested. But like I said, teenage girls just have an immature endocrine system still. Their body's trying to figure out exactly what to do with all of this estrogen and these receptors. And so sometimes this can last about a year or two to kind of get it straightened out. Okay, so let's talk about the best thing about this is treatments. Like I said, get a diagnosis first and let's figure out what is going on, because that's going to really obviously tailor the treatment of how we do this. But I'm going to give you kind of 5 suggestions here. So number 1 is take ibuprofen. It's not the most natural thing, but ibuprofen is an anti-inflammatory medication that can lower your menstrual flow by about 1/2. So it lowers the prostaglandins, which are little inflammatory molecules that can cause a lot of pain and also that heavy bleeding. So NSAIDs are not great for stomach and gut lining, so you want to be kind of sparingly with them. But if you're miserable and you're working through some like deeper reasons or getting a diagnosis and you're dealing with this right now, NSAIDs, again, it's not medical advice, but NSAIDs can be helpful at reducing that menstrual flow. Number 2 is work on insulin. When we talk about your hormones, we talk about this pyramid, and on the very bottom here is going to be insulin, cortisol, and adrenaline. So we gotta work on our blood sugar. Insulin can thicken your uterine lining, which can create heavier flow when it's shedding. It also can impair ovulation. So if we have insulin that's imbalanced, too high, our body's exposed to too much insulin, our body can stop ovulating or not having as great of ovulations, which ovulation, remember, is what produces progesterone. So if you don't have enough progesterone, you're probably going to have heavier periods because it's not there to oppose that estrogen level that causes such heavy bleeding and a bunch of different PMS symptoms, breast tenderness, cramping, clotting, all of those great period symptoms that a lot of us are accustomed to. So we really want to work on our insulin by eating a protein, fat, and a source of fiber, usually in the form of fruits and vegetables or produce, at as many meals as possible. That will help keep your insulin level really balanced. If you can, you want your meals to make you full for about 4 to 6 hours between, so that you're not just constantly snacking and increasing your insulin level and exposure. So again, 3 to 4 meals a day with protein, fat, and fiber at each one, and that should definitely help your insulin level. The other part of insulin that we don't talk about, we talk a lot about nutrition, is actually minerals. So there are, again, minerals are a wide huge world out there, and no minerals really work in isolation. So they all kind of work together, and they're basically like the spark plug to our metabolism and all the different functions that our body uses. So blood sugar regulation and insulin is highly manufactured and managed by these minerals. So things like magnesium and chromium and sodium, potassium, these are all important in our blood sugar regulation as well. Okay, number 3 for treatment is exercise. So exercise actually improves insulin sensitivity, which is great. The more muscle we have on our body, the more sensitive we're going to be to insulin, which is great. We want a bunch of insulin sensitivity. We don't want insulin resistance. Exercise also reduces inflammation, which it reduces those prostaglandin chemicals and molecules I was talking about earlier that cause heavy bleeding and a lot of pain around our cycle. So getting our body up and moving can also help detox estrogen well through our liver and out through our large intestine. So even if you don't feel like a really intense workout, that's totally fine. But try to lift some weights a couple times a week and try to just go for walks to just kind of move your body, and that will help improve all the different things I mentioned. Okay, number 4 is to look at your estrogen progesterone ratio. So this is doing a little bit of hormone testing, but if you've kind of gone through, you know, the ultrasound, you've kind of gone through like coagulation disorders in your body, you've tested your thyroid, things like that, there's probably a really good chance that it's related to your estrogen progesterone ratio. So one thing that I said, remember, is that ovulation is going to trigger a rise in progesterone. So you really want the right amount of each of those hormones at the right time and have just a healthy full month-long cycle. A lot of us don't really think about our cycle until we start to get PMS, maybe a week or 2 before our period, and then our periods are crampy and clotty, and we get breast tenderness, and we get moody, and we get bloated, and water retention, and headaches, and then we have heavy flow. These are all symptoms that your estrogen progesterone ratio is off, and so you can test that in a few different ways, but you can test it through blood, saliva, or urine testing. Depending on what practitioner you go to, you want to make sure that you test these numbers about 7 days post-ovulation. That's going to be the best data for you and the most accurate for us to look at. So find a practitioner who will do that with you and then also knows how to treat it in a way other than birth control. So, for estrogen, we'd want to detox it well. We'd want to make sure that that level is supported. We'd also want to do the same for progesterone, which I have a video all about low progesterone and how to support that I'll link down in the description below. Okay, number 5, you guys, is eat phytoestrogens. I think we think of phytoestrogens as things that are going to help raise estrogen levels, but that's actually false. They actually help kind of regulate estrogen levels. So things like nuts and seeds, flaxseed, edamame, or soy products, these things are called phytoestrogens, and basically what they do is they block the estrogen receptors in your brain or in your body, and that promotes a healthy metabolism of estrogen, so meaning detox of estrogen basically. So eat your edamame, eat your flaxseed, your soy, your pumpkin seeds, all of those different things will help kind of regulate your estrogen balance a little bit better. And then lastly, you guys, look at your minerals. So I think the best way to look at minerals is to do hair tissue mineral analysis. This is looking at intracellular. A lot of our minerals are just inside of our cells, meaning that if we just get a blood test and look at our micronutrients and minerals, they may not give us the full picture. So I'm a fan of looking at hair tissue. I offer that in my practice. Super, super helpful at looking at sodium, potassium, magnesium, calcium, iron, zinc, boron, some of the toxic heavy metals, a bunch of different things. Super, super helpful at learning at what is going on for you and how your body's handling stress. I also think, like I mentioned, there's this kind of like dichotomy with iron. And so a lot of practitioners will just diagnose you with iron deficiency, tell you to take a bunch of iron and be on your way. And like I said, I'm going to do a whole video sometime about iron, but we are exposed to a ton of iron each day through our food, through our environment, through medications, different things. And a lot of us actually have an excess of iron, but we are unable to actually use this iron because it's not being recycled well through our body. And back to kind of what I was talking about earlier, the reason for that is actually a copper deficiency. So copper helps produce ATP energy in our body. It helps do a ton of different things as well. So you really want to make sure that you're getting adequate copper, which can be through things like oysters, organ meats, spirulina, chlorella, blue-green algae. So if you want to do like a greens powder, or like I said, take beef liver in capsules, that's super, super easy. It's not gross. You can't taste it. Because I know a lot of us just won't eat liver or organ meats, myself included. So I think that could be a really great option at just getting in a ton of different micronutrients. But again, you want to work with somebody who's qualified to tell you what you need. Make sure that's even the right diagnosis for you. It's not due to something like a fibroid or something else, because that really is the basis of heavy periods. You really want to figure out, just kind of go through the checklist that I mentioned earlier and figure out where you're at and what your diagnosis is, because that will really help us tailor obviously the treatment for that. And even if it's something like a fibroid or a cyst or something like that that's causing heavy periods, we'd obviously want to diagnose that, but we'd actually also want to, or in my practice, I ask also, okay, well, so we know this fibroid's there, but like, why is it growing? What's the environment that's allowing it to grow? Is there not a great detox system? Is there too much estrogen? Is there not enough progesterone? So we'd also want to kind of correct the environment in there that allowed this fibroid to grow, while working potentially with Western doctors to fix the fibroid itself. And again, there's lots of other options for fibroids as well. But that's pretty much what I do for heavy periods. I want you to, again, just get the diagnosis and then work with somebody who can look at your body holistically. Like I said, hormones, mineral levels, thyroid, all of these different things really contribute to this in a huge way. And so hopefully this was helpful for you. And know, if you're going through this, there is definitely hope for you. You don't have to live with heavy, horrible periods forever. I've helped hundreds and hundreds of patients, lighten up their cycles and have a more comfortable cycle too. If you want a free guide called 6 evidence-based habits for healthy hormones, go to alliedamron.com/habits. 6 habits for you to start, super simple things for you to start now to kind of rebalance your hormones, have better periods and better cycles, because I know that most of us really don't want to deal with PMS and heavy periods and all the symptoms associated with our cycles. So these 6 things will help get you on the road to healthier hormones. If you have friends and family that can benefit from this information, don't be afraid to share it with them. I really would love to educate as many women as I can. And so share this info with them if they could use it as well.